We are going to talk about the anatomy and physiology of breathing. This will be a multi-part series because there's a lot of information here, and I want to make sure that all these concepts are laid out clearly and simply. That being said, if I say something that doesn't quite make sense or glaze over something that you think needs more attention, please leave a comment on this video so that I can clarify however I can. In this video, we're going to cover the skeletal structure that houses our respiratory system or our system of breathing. So we have our skeleton here. We're looking at it from the front. You can see that I've taken off one side of the rib cage, and that's just so we can see things as clearly as we can. We're going to start with the spine. So here we are looking at the body from behind. This is known as the posterior view. And let's zoom in here. All right, so here we are with our nice close-up of the spine. The spine has three main parts. Go ahead and put lines here so that we can see. We have the cervical spine, the thoracic spine here in the middle, and then the lumbar spine, which is partially seen down here. For today, we are going to focus on the thoracic spine because this houses the structures for breathing that we most commonly think of as singers, for example, the lungs and the diaphragm. The thoracic spine consists of 12 vertebrae that are commonly referred to by numbers, like this: T1, T2, and so on. Connected to the thoracic spine are the ribs. Just like the thoracic vertebrae, there are 12 ribs total, and each one connects to the corresponding vertebra, as you can see here. We have T1 connected to R1 here. In this image, the whole structure looks a bit stiff, but there are actually joints where the vertebrae meet the ribs that allow movement. These particular types of joints are called synovial joints, which means that the bones themselves don't actually touch, but are able to glide against each other thanks to a thin fluid held in the cavity between the bones. If you take a deep inhalation, you'll notice that your entire rib cage moves up and expands out. This is about the range of movement that is facilitated by these little joints. Before we move on to the ribs themselves, let's move around to the front view of the body, also known as the anterior view. From here, we're looking directly at the sternum. You can see in the image, the ribs come around from the spine to meet at the sternum. These points here. They are attached to the sternum with the same synovial type joint that connects the ribs to the vertebrae. As I mentioned earlier, there are 12 ribs total. The first 7 ribs from top to bottom are known as the vertebrosternal ribs. They're also called the true ribs because they are connected to both the vertebrae and the sternum, hence the name vertebrosternal. These are our most structurally sound ribs. The next 3 down are known as the vertebrochondral ribs or false ribs. While they do still connect directly to the spine, they're not directly connected to the sternum. Instead, they're connected by cartilage to the rib above, like so. If this is R8 and this is R7 here, R8 connects to R7, R9 to R8, and R10 to R9. To get to these last 2 ribs, we're going to go back to our posterior view here. From here, we can see these final ribs, R11 and R12, are known as floating ribs because they are only connected at one end here at T11 and T12. The other bones that we've got here are somewhat passive to the respiratory process, and that would be the clavicle, which again, we're looking from the posterior view here. So the clavicle is in front, and the scapula, which is here at the back of the rib cage. The clavicle connects here with a synovial joint, again, to the scapula. Thanks to the help of some muscles that we'll talk about in the next video, and of course the synovial joints, these bones are able to move about, specifically move up during the respiratory process. Again, if you take a deep inhalation, you'll feel the scapula sort of gliding upward and outward along the back of your rib cage, and the same with your collarbones. All right, these are the bones that I wanted to cover today. If this information is something you want to know deeply, I highly encourage you to take out a notebook or whatever it is you write on to write down the things you learned today. And tomorrow morning, when you get up, write it down again from memory to see what stuck in your mind. Repeat this process until you have really internalized this information. If you're just watching to pass the time, thank you so much for spending your time with me. In part 2, we're going to get into those muscles of the respiratory system and how they work. Until then, I hope you have an amazing day. See you next time.